Okay, this is the first of a series of presentations, panel members from member countries. We're starting off with our Nordic panel, who are going to be sharing with us innovations and developments from the Nordic countries and collaborations that are working across those nations. They've already demonstrated their ability to collaborate by having all their PowerPoints put on one stick. So that was really helpful. Thank you very much. What I'm going to do is I'm going to introduce each of our panel members briefly, and then each is going to present on what's happening in their respective country. And we'll leave about 10 minutes towards the end for a question and answer and discussion. Can everyone hear me? That's working all right? Okay. All right, firstly, I'd like to introduce the first person on my right, your left, which is Sif Holst. Sif has been the Vice Chair of Disabled Persons Organisation of Denmark since 2015 and represents the organisation on a number of boards, including the Nordic Council's Disability Council, which is the cooperation between Denmark, Finland, Iceland, Norway, Sweden, the Faroe Islands, Greenland and Åland, and the European Economic and Social Committee. SIF is very engaged in increasing the physical accessibility and health-related issues regarding disability. Next on our panel is Maria Montefusco. Maria is a Senior Advisor in Disability Issues at the Nordic Welfare Centre. Nordic Welfare Centre is an institution under the Nordic Council of Ministers, which is the governmental cooperation between the governments of Denmark, Finland, Faroe Islands, Greenland, Iceland, Norway, Sweden and Åland Islands. Maria is also Secretary of the Nordic Council of the Ministers' Disability Council. Next on the panel is Anders Meilvang. Anders is Chairperson of NIIK, which is the National Umbrella Organisation of People with Disabilities in Greenland, so a federation of disability organisations across Greenland. And then we have Christina Johnson. She is the National Spokesperson for People with Disabilities in Greenland. This is an organisation as politically independent national advocacy organisation established by the government of Greenland in 2017, working for the rights of people with disabilities and the full implementation of the UN Convention. Christina is the first spokesman for people with disability in Greenland, and she has led the process of building the organisation. And finally, to my far right, we have Ola Balke, Senior Advisor at the Swedish Agency for Participation. He's worked on international issues, research, coordination, leadership, and communication. So would you please welcome our panel? And I'll now hand over to Sif, who will get us started. Maria, who will get us started.
Thank you very much for that. So now we will not have to repeat what countries are in the Nordic Cooperation. That's good. That will spare us like 5 minutes of our presentations. Okay, so we have this death by PowerPoint. So we will start, and none of us will see the pictures. And then we will look like this because we will look at the board over there. So sorry for that in advance. My name is Maria Montefusco. I will try to give an overall image of how we are cooperating on disability issues, and then 3 of our countries will present, and usually we are 8, but this is a strong trio of countries that we are here with. We hope to be many more countries next time. So the Nordic Cooperation is a very old, politically and democratic cooperation. It started post-war in Europe. The Nordic countries wanted to develop and become stronger together. And here we are many years later. We have a population of in total 26 million people. And we cover, thanks to Greenland, we cover 5 time zones. So we are very happy for that. And we have common Scandinavian languages, Norwegian, Danish, and Swedish, but we also have other languages that are not so similar to the others, such as Sami languages and Greenlandic and Finnish. But within the cooperation, we use Scandinavian, as we call it. It becomes Blandinavian, and sometimes we use English. We have a really strong economy. I don't know how many economies there are in the world, but my material says that we are the 11th strongest together. And we have an area that represents 2 indigenous peoples. So the Sami people in the north of Scandinavia, northwest of Russia, and also the Inuit population in Greenland. We cooperate a lot around the Nordic model, as we call it. It's actually many models of different areas, but in our case, we collaborate a lot around welfare policy, and we have similarities, but also differences in that. In our vision for the governmental cooperation, we have a target which says welfare for all and democratic participation in society. And the vision is also, its highest target is about becoming the world's most integrated and sustainable region in the world. So in 2030. Okay. So 2 different parts of the Nordic cooperation. We have the cooperation between governments, which is what I work for, and then we have the cooperation of parliaments. So the Council of Ministers is the governmental cooperation, and there is cooperation in 11 different policy areas and several cross-sectorial perspectives such as gender equality, children and youth, and also disability. So all the countries rotate in chairmanship, and right now it's Iceland, the Holst presidency. Next year it will be Denmark. We have a new General Secretary. Her name is Paula Lehtomäki, and she's the first woman in the post since all of these years, and we're really happy for that. And it's also a challenge for us to have language situation now when we have a population leading the cooperation, which is not actually as much into the Scandinavian languages always. So it might be a change in the Nordic cooperation when it comes to language policy. There will probably be more English. So we're happy we're here to practice. The Nordic Council, another thing, but they share secretariat. It's the parliamentarians. So we have 87 parliamentarians from the national parliament sitting together and having cooperation in different policy areas. Moving over to the disability cooperation, the Nordic Council of Ministers has 3 tools, and this is where it comes to models for disability mainstreaming and how we work together. There is the Nordic Welfare Center, which is where I work, which is the operative body, you could say, I suppose, with project management. We coordinate networks of different kinds. We do things to develop welfare policy and inclusion, strategies for inclusion of different vulnerable people. And our mission stretches from everything from dementia to different kinds of work inclusion policies and education and creating age-friendly cities and so on. And then the Nordic Council of Ministers has an action plan which is focused on human rights, sustainable development and freedom of movement, and I will come into that a little bit more. And then there is a council. As you heard in the introduction, we are the region of councils. We have councils everywhere, and now we have this Council on Nordic Disability Cooperation, which I'm the secretary for. Very proud of that. The Nordic level is in between the national and the European and other levels. So we always do this analysis and strategic planning around the added value of Nordic cooperation. We should not do things that is already done on the national level and not things that is already been done on the European or the UN or Council of Europe level. We try to find the level in between and do things that contribute in a special way, which cannot be done in the other way, in the other levels. So we try to find synergies. For example, when a European directive is being implemented, we have a Nordic group working together to look for best practice and good ways of doing things in a way that doesn't create new barriers and using the resources in an efficient way. It should also strengthen networks in all of these other levels. There is also a very strong work going on right now on how the Nordic cooperation in itself, it's supposed to be more inclusive. There is a strong work on the disability mainstreaming in the different policy areas, and if I have time I will come into that soon. And also the Agenda 2030 has become a very important political framework for everything that is done in the Nordic cooperation and also in the disability cooperation. Except for the Agenda 2030, our political framework is very much the impact of the UN Convention of the Rights of Persons with Disabilities is very important, and that is actually something that we always have in mind when we do things, how the things we are doing is contributing to the implementation of the convention. And we try to find for similarities and differences, and these maps that are on my picture, they show that how many states have ratified the convention, and in the Nordic region all of the countries have ratified the convention, but then on a map below it, it shows that the Nordic countries have different stages when it comes to ratifying the protocol connected to the convention. And then what we do is we try to find out why and who is right, and usually we don't agree, but sometimes we do, and then we can continue. Well, we usually do. The Nordic Welfare Center, when it comes to disability cooperation, it's a lot about the UN CRPD and welfare policy also. But very much now our countries have difficulties or challenges with implementing the convention, so that is what we're trying to be helpful with. We also have within the deaf-blind area, we have courses and networks of leaders working with issues of tactile language, for example, so very practical level. So we do a variety of things in that. The Disability Council then, we are really proud of the composition. It consists of experts appointed by the governments and experts appointed by the NGOs, the organizations for persons with disabilities. So they both, in each country, appoint one expert each, and the council always acts together and is advisory to all the political sectors of the Nordic Council of Ministers. So when the Council of Ministers get an advice, it will be throughout a very wide consensus process in the council, and they will be able to what's it called, accountability, or like it's very legitimate, the advice that they get. What else, Ola, is on that? Well, the Secretariat is at Nordic Welfare Center, which was what I explained before. One very important task is to make sure that the disability perspective is mainstreamed throughout the Nordic Council of Ministers' whole organization, and especially in the relevant policy areas. So we have this yearly follow-up on all the policy areas to look at the steering documents of the sector, if they finance activities which aims towards inclusion of persons with disability or better accessibility, universal design. And as it looks right now, we just did this, we can say that the majority of policy areas do this, and they do it in a very inspiring and creative way. Almost all of the steering documents mention persons with disabilities and inclusion in their programs, which is a very good development, because they didn't a couple of years ago. The council works with different thematic areas, and these last couple of years, thanks to Sweden's initiative about disability leadership. That is one of the thematic areas that we work with right now. But some more are children with disabilities and breaking the taboo about sexual violence and harassment. And we have been doing that for a couple of years as well. And the disability mainstreaming, of course, is something that we always do. The action plan, how am I in time, Garth? 1 minute? Okay. So as I mentioned, the action plan on disability cooperation, it's for a period from 2018 to 22. And it has 3 focus areas. It's human rights, sustainable development, and freedom of movement. And then activities under each of those areas. So within those areas, the activities, we build networks, we find research, we try to facilitate developments that we can do together. We have dialogue with relevant international actors on the UN and the EU and Council of Europe level in order to bring as much knowledge and inspiration as possible to the region. And in many cases, we really need that. For example, when it comes to indigenous inclusion, which is one of the focuses we have when we are here during this week. So I could talk about this forever, but it's late in the afternoon. The future challenges that we have, that we talk about, and that we are reflecting on, not least here during this week. The welfare state and the welfare model is challenged, so we need to find new innovative ways of meeting the challenges of demographic developments, for example, digitalization, migration, things like that. So that's something that we need to work on. There is a political change, or the political context is changing, and some people talk about an ideological crisis within the welfare policy sometimes, and that's something that we talk about. Can innovation strengthen or weaken, for example, our traditional ways of having universal support for everyone? We have lots of research data, we have good policies, we have legal frameworks to be very proud of, but implementation is still a problem. And so, not least during these days, we've been reflecting on this, whether it might be the leadership that is lacking, and how can we build up leadership in a strategic way that is not about management and evaluation, but more like the skills of taking things to the real lives of people as they are supposed to, according to law and policy. And now my time is over, and I'm actually finished, so yeah. Thank you.
Perfect.
You're Swedish.
Actually, what I'm going to do is I'm going to sit in the front here, then I can be more explicit about my time checking. Thanks.
Oh, I'm scared now.
I'll be subtle.
Hi, I'm Steph Holst. I'm the Vice Chair for the Disabled People's Organizations Denmark. So I'm going to speak a bit about also the action accountability, what we're doing a bit in Denmark right now. We have been just making our disability work, and we have been talking, who are we, what are we doing? And what we think is that when we come to social rights, to labor market, education and health and accessibility, these are the key factors, because only when we work with these issues, we can ensure that people with disabilities can participate, contribute and live a life like everyone else. This is our goal. This is what it's all about. So we are trying, and I have some examples under the different elements. But of course, we work on a lot more than the examples I'm bringing. But we've really been trying to define, why are we here, what are we doing, and why are we doing it? And this is one of our key points. In regards to social rights, we have been talking, because also, as Maria was saying, that we have had this challenge of the welfare states. Where are we going? Why are we going? Are we just fighting for funds just because we are fighting for funds? Where is our vision for this area? So we have been working for the last 2 years about making a social policy. This is internal in the disability movement, but now when we have developed it, it's of course also meant to be taken to the government, taken to all our colleagues. Our start of this new policy says that people with disabilities want to be part of the community, participate in the community, contribute to the community, as far as possible to live a life like everyone else lived their life. The goal for the social policy should be to give everyone else a good life as humanly possible. So this is what we want to achieve, and that is why we have the social policy. So if it doesn't contribute to this, we shouldn't do it. And one of the examples is, of course, that we need social policies in order to, for example, have the labor markets. We want to unleash the enormous potential there is among persons with disability. I brought a picture just from the papers this week. This is Antoinette. She is a master in educational sociology, and she can't get a job. She's been employing and, sending application after application, and no one wants to hire her. And we just had a study. The reason why we are having a lot of focus on her this week is we just had a study where they asked a lot of employers saying that we have this general candidate, good education, a couple of years of working experience, good worker, a good temperament. Everything is fine. If you want a new employee, do you want to hire that person? So 70% said yes. Then they said, oh, by the way, that person is in a wheelchair. Do you still want to hire him or her? Now only 22% said yes. From 70% to 22% just for knowing that there's a wheelchair. And Antoinette is in a wheelchair. So we use the story to go to the media, go to the minister saying, this can't be right. We know there are other issues for when you're not hiring persons with disability, but this, just because it is a wheelchair, isn't right. So we are trying to have action because of the story. We are trying to collect as much data as possible and then, take action on that one, telling everyone, now you can't just excuse yourself for anything else. This is just because of the wheelchair. You should hire a girl like Antoinette, who's skilled and newly educated and everything, instead of making excuses. But of course we know, and that's the other thing, that education, we know that a lot of persons with disability have a less education and maybe not the right education. So that's of course also so important that people are given the chance to have a proper education. So we have a lot of focus on all the different labels from the primary school, secondary school and higher education. And this is one of our brilliant examples. This young lady is called Astrid. And she has CP, and she doesn't speak. You can't understand her. So she's using the computer in front of her to speak. And she's so brilliant. I think she's the next Stephen Hawkins. She studies at the high school, and she studies biotech studies. So she wants to go to university and do this. But the only reason why she's able to study in high school is because her particular school has said, okay, you have to take your time. We'll just extend. That's normally not allowed. But she says, okay, you are going to have 4 years instead of 3 years of high school. So what? So that is what we need more of it. And we actually have the idea that when you go sports professional athletes, swimmer, football player, something, you're allowed to extend your high school years. So study in 4 years instead of 3 years. We call that the Team Denmark system. So why don't we have the same for the persons with disabilities? Why shouldn't, when it's possible when you're a sport athlete, why shouldn't it be possible for Astrid to do the same thing? And her local high school thought it was possible even if they were bending the rules. So we want more examples like her. And again, we try to use example like her because everyone can see she's brilliant even if she doesn't have a language. We also have a lot of focus on health, because if you have poor health, you don't get the education, you don't get the job, and you have a bad quality of life. We know that some persons, we know a man who has a mental disability dies 20 years before another man. We know that a man with developmental disabilities dies 13, 14 years before another man. So we have these issues, and we know we have to do something about it. We know there's a lot of comorbidity also with persons with disability. We also need to be focused on that one. And one of the things we discovered is working is early detection. So especially for those with developmental disability who has difficult speaking, we have a yearly checkup. Just go to the doctor, find out if everything is working in order, and they always seem to find something. Maybe they have sore feet, and maybe it's a simple things that they haven't had their toenails clipped properly, or something else is developing. But because they have sore feet, they don't want to walk. Of course, you wouldn't either. But they can't say it. They just say that, no, I don't want to walk. And then when they don't start to walk, then they become more fat. And so it's all the way, if they have some small hearing problems no one was aware of, they will become less social and become more lonely. So we have to have this checkup regularly in order to do it. And of course we have to understand that all these things, a healthy life, you have to have the chance to make exercise. And if these exercise facilities aren't available for you, it's a problem. So we have to work on that. We have to work on the chance of healthy eating. We have to work on the chance of drinking plenty of water. That means also being able to go to the bathroom when you need to go to the bathroom. So all these areas, and we know a lot of persons with disability are lonely. So we joined People's Movement Against Loneliness also to have a focus on that one. And the last area is accessibility. We work a lot with universal design. We work a lot with understanding. So we go to, for example, the architect school and, trying to get them to understand that they shouldn't just do universal design because they should do universal design. They should do it because it matters. They must understand on their own bodies, why does it matter? I have a lot of working with the Outdoor Council for the last couple of years to understand the pathway in the forest, that they should also be accessible. In the beginning, they were saying, no, we don't want people with disabilities going all over. We don't want this asphalt throughout our woods and, all these ramps and something. No, it's not in our woods. But they started understanding this is not what it's about. It's about everyone, even with a wheelchair or an elderly person or one with a baby stroller, being able to go out and enjoy nature. And it should maybe be every forest path that's accessible, but some should, and it should be very clear which are accessible. So it's also about registering. And I've just been developing, when we were here in the United States, I've been going around looking at nature paths and looking at tourism, because that's another key point for us. And I've developed this new theme, universal courtesy. So we have this universal design, is how we do buildings, how we do apps, how we do things. But a lot of things is how we treat each other. How do we welcome each other, both in the workplace or when we go to a hotel, when you go to a restaurant. And we really need to talk about that also. Because how you're welcome makes actually a lot of difference. Not only, of course, you still need the ramp or whatever you need, but you need to be welcome and feel welcome. That's almost as important as having the ramp. So we need to talk about universal courtesy. A new word. Now you're ready to go everywhere and talk about universal courtesy. And that's it for me.
Thank you.
Oh, it's me.
It's great when a plan works, doesn't
it? Yes, hello. I would use the opportunity to say thank you for having Greenland here. It's the first time, and we are very grateful for that. We have joined in the match we were with the indigenous people, and it was incredible how similar problem we have, the Inuits have with Aboriginals or Indians and Maori. So that's been very good for us. So we want to come again. Maybe next time it will be like Americans, but you never know. Yes, my name is Meilvang. I'm not an Inuit, but I moved to Greenland 30 years ago and have been a judge and a lawyer here. I fell in love with one of the local beauties, which I've been married to for 25 years. So I feel pretty much like an Inuit. And I have adopted 2 children from China, so we're kind of a global family. My eyes are went very bad, and so I can hardly see anything anymore. So I'm a very bad lawyer. So then I have to retire. And it was obvious to me to go into the work of the civil society. Civil society in Greenland is very weak because we are very few people and we don't have so many resources. So there was not many organizations for disabled people. So I was one of the founders of the Association for Blind and badly sighted people 5 years ago. And last year we formed this organization, NIIK, which are the umbrella of these 5 organizations, to try to be stronger, because we want to be heard. That was what we heard earlier. That's important that the disabled people are heard. That's the only thing which can make the right solutions if we are in the process. But it's difficult. We are only 5 organizations. There's less than 100 people, members in each of them. The umbrella organization is right now is just me. I don't have a secretary or any expert. So I will only tell you about the barriers and the challenges, because we don't have so many good ideas or solutions yet. But we will come, like Denmark had their organizations for 100 years. So for us, it's just important to be there and build up. So do I have the slides changer? What happened? Nothing. Okay. These two numbers says everything about our challenge, actually, because we have the largest island of the world. We have the largest island of the world because Australia is a continent. It is 3,000. So we got that. It's 3,000 kilometers long and 1,000 kilometers wide. So, but we only live 56,000 people there. So you can already see what challenge we have. 80% of it is covered by the inland ice. There's so much ice, if it melts, and it melts very fast now, all the seas of the world will rise 7 meters. So goodbye, Australia. The Inuits, this is very different from indigenous people elsewhere, because Inuit, the Greenlanders are Inuit, and they are 90% of the population. So it's a majority in the country, and we are part of the Danish kingdom, but we have autonomy. So it's Greenlandic politicians who can make the policies and so on. So it's a totally different situation. But our geography and demography give all the challenge, because we are scattered in 70 different settlements. So it means that many small settlements are on 50 or 100 people. The capital is only on 17,000 people. So it's very hard to build up a disability services in these cities or any other services almost. So even though it's a welfare society built on Danish model, it's very hard to implement. And one of the reasons is that only 60% of all young people only have primary school. So that means that we really need skilled people. So if you're disabled or mentally ill, it's very hard to get some skilled people who speak your own language or you know your culture. It's often Danish people coming, and they are only there for a year or two. So that's actually our biggest problem. Not so much money actually, but the lack of human resources. We have like other indigenous people, we have the history of colonization. Greenland was a Danish colony. It was colonized in 1721 and became an equal part of Denmark in 1953. It is a little special relation because normally you don't go back to your motherland. So, but it's a part of Denmark, what would I say with that? Yeah, but this it gives a lot of trauma from the I cannot say that. Colonization. Sorry, my English is, yeah. But, so, many people are very traumatized. We have the highest suicide rate in the world. We have a 1/3. Before it was half, but 1/3 of all Greenlanders have been sexually abused. We have a lot of violence, especially against women. So that means that leadership is important, but we need healing first. Many people have to try to get rid of these traumas, and it's difficult because we don't have these skilled Greenlanders. But we are working on that. But then that is really one of our big problems, and we have to find some community-based solutions, like we talked on earlier. But before we can make that, we have to raise the mentally health or the tribe of people. So there's a lot of work there. So he put the finger. Oh, yeah, but he put the finger up, so I have to take it away anyway. So thank you. I'm open for question later on.
Thank you.
Yes. Hallo, Christina Johnsen nimik ataqarpunga kalaallit nunaaninngaanerpunga. Hello, my name is Christina Johnson. I'm from Greenland. I'm a spokesperson for people with disability. Actually, the first spokesperson ever in Greenland with disabilities. And that's very good because I can take the leadership. Yes, and make people follow our work, and we can make changes in Greenland. We hope we can. I am my organization Tilioq is funded and paid by the government, but we are a non-political organization, and we act like a bridge between the civil society and the government. Our name is Tilioq, which means messenger, the messenger. So we deliver messages from people with disability to the government, to the politicians. I'm also tired. This is our secretary, Ida is sitting over there. She's our project manager, and Oline, she works with the information office. And this is actually a picture from our latest trip in South Greenland, and it's taken outside a school in Nunatsinni, and it has about 100 citizens. And the former picture is a picture from NIIK, as Anders mentioned, has 17,000 citizens. So in Greenland we have a lot of different lives and opportunities. Our work in Tilioq is to make debate, and we also do a lot of work with advise people with disability and their relatives and all the societies. In Greenland, people do not know enough about their rights, and we are doing a lot of work to tell them about the rights. Actually, we made this little thing, the right for people with disabilities, and we translated into Greenlandic and put some Greenlandic figures in it, and gave it to a lot of people. In Greenland, we also have difficulties with, we don't have enough research and data. Every time we hear numbers and percents, how people live, it make us think like Sif said, in Denmark they have a lot of data, and the politicians listen when they hear numbers. They cannot relate to anything else. So we also have to do some work in Greenland to make some research. We are trying to collect and communicate information about people's life in Greenland. What was I supposed to say? Yes, we had a lot of things to do in Greenland. We don't have a law that where it's illegal to discriminate people with disabilities. Actually, you can dismiss or fire a person if he or she got a disability. Our social network is not very good in Greenland, so we are pushing for that the government make laws which includes everyone. I think I said what I want to say. Yeah, you can ask questions later, and we will put these small folders in the marketplace tomorrow.
Thank you.
Yes, hello, my name is Ola Balke and I'm working for the Swedish Agency for Participation. So now comes the government, finally. You can see also Sweden, it says there, if you had forgotten it already. I prepared a presentation which some of you already heard a little bit. That goes for Marianne, Cecile and David, who was in our match the other day. I just prepared something. I was not quite sure what kind of presentation I would do, so I prepared something, and it goes for 2 times now, so it's very good. But now I changed a little bit. A slight change to be very clever. To be yes, I shorten it. Garth shows me, yes, a little bit. But I wanted to be as clever as possible, so I framed it with the keywords for the conference. The AAA, the access, accountability, and action. And then, since Garth wanted me to, I also put innovation into it. So I think I'm very clever. Now, short about the policy. The Swedish disability policy is leaning on some fundamentals, and the fundamentals, of course, is the CRPD, as you know all, and also Agenda 2030. We already saw this photo before. Maria, thank you. Now it comes twice. And also we have a quite strong discrimination legislation in Sweden. So that's the fundament. I don't think I have to go deep into the convention. I think you all know about it. So the first slides, that was the access. I mean, to access the Swedish disability policy at all, you have to have this fundament. And when it comes to accountability, we are now on the national level. And by the way, this framing with the keywords was just an attempt from my side to put it the right way. Maybe I misunderstood the words totally, so maybe it's wrong, but that was my attempt anyhow. And the objectives of the Swedish disability policy is to achieve equality in living conditions and full participation for people with disability in a diverse society, and actively contribute to increased gender equality and to consider the rights of children. And the direction of the policy, the first one was the goals, and now it's the direction is more over a longer period of time. the direction should be the principle of universal design, to identify shortcomings in accessibility, to offer individual support and solutions for individual independence, and to prevent discrimination. What is the Swedish Agency for Participation? Well, it's a fairly small Swedish agency. In Sweden, we like to create agencies. I think we are the most governmental agency dense country in the world. We have 342 governmental agencies in Sweden. In most of your countries, the policy making and policy monitoring and so would have been inside of the ministry. But in Sweden, we like to put it a little bit outside. We are like the prolonged arm from the government itself, from the ministry. And in our case, we are under the Ministry of Social Affairs. And what's our agency's business? Of course, we are trying to make people participate in the society, since that's part of our name. Participation is very important. It should actually be in the name of our agency. It should be participation for people with disability. Otherwise, it could be for everyone in the country or in the world, but it's for this group, of course. And also, we are collecting and developing and also disseminating knowledge. That's an important part of our job. And our target groups, mainly other governmental agencies. That's the most important thing. Also regions and also municipalities. We have 292, is it? 292? No, 290. 291, sorry, I should know this, but it's quite a lot of them in Sweden anyhow. And they have quite strong self-independence, so they can decide quite a lot what to do themselves. But the governmental agencies, they have to obey what we are telling them to do. This is the meaning, the definition of participation, as we say it in our office: to be a part of on equal terms. The right to participate is a human right. And also autonomy and self-determination. Accessibility, when we are talking about accessibility, it's within environmental questions, transport, information and communication, and goods and products and services, and digital solutions. Universal design is also a crucial term that we are working a lot with. I think you all are familiar with the term, so I don't have to talk about it. And one thing that we are very keen on, and that's also in the convention, is the active involvement. Yeah. It's very important to have the people with disabilities within all kinds of decisions and projects and so on. And we are quite good on that in Sweden. And we are trying really, especially in our agency, to look after it. When it comes to innovation, the last one of the keywords, or the added keyword, we had an interesting project about accessible elections and the electoral process quite recently. You can read more about it on our website. We also had a study on refugees. Maybe you noticed some few years ago we had a lot of refugees coming to Sweden, and quite a number of them were suffering from different kind of disabilities. For example, hearing impairments because of gun shooting and bombs and things, and also post-traumatic stress disorder because of the situation they fled away from. So that's it. If you want to reach us in the electronical way, here you can see some of the possibilities. Thank you.
Thank you.
Thank you very, very much for each of your contributions. We have a couple of minutes when we can take some questions from the audience. Do we have any questions?
I was wondering, thank you very much for your presentations this afternoon. It was brilliant. And I've never seen a picture or met anyone from Greenland before, so I'm very excited. I was just wondering how many of the Nordic countries have actually signed up to the UN Convention of the Rights of the Child, because you were saying that there's no policy or legislation in Greenland that stops discrimination against people with disability. So
thank you. Christina or Anders may be answering better about Greenland, but all the Nordic countries have ratified the Convention of the Rights of the Child. Sweden and Norway have chosen to make it become a part or incorporated into national law, whilst the other countries have it as a convention follows the reporting cycle of the reporting to the UN and get the list of issues and things to work on. And several of the Nordic countries have gotten concluding observations from the children's or the Committee of the Rights of the Child that they are not addressing the needs of children with disability enough. So we have a process with the Committee of the Rights of the Child in several of the Nordic countries. Then still we are doing a lot of good things around children and children's rights, and we have that tradition for a very, very long time, abolishing to hit a child, for example. It has been forbidden in the Nordic countries for a long, long time. And but still there are some really big challenges, for example, when it comes to methods of hearing children with disabilities in choosing social measures, for example. There is some research on how children are not listened to when they take decisions of children being like in not foster homes, but we call it a short time home, sometimes to give relief of the family if the child needs or the family needs to have some time alone, so to say. That could be good for the family, but according to research, the child has not, in fact, been involved with the decision-making enough. That's one of the critiques that we have gotten. But then I don't know about Greenland. What about the...
You asked about the discrimination, whether it's... how come it's not forbidden? We still don't have the law that says that it doesn't have consequences for people to discriminate people with disability, like deny them the entrance to restaurants and bars. So it's the kind of allowed to discriminate that way. We got a law that make it you cannot discriminate about gender or sexuality or color or race, but we still don't have about the disability.
Thank you. We've got time for one more question. Yes. You have two. Thank you.
Is there a lot of support for say young people with these issues? That was a short answer. Who are you asking? Pardon? Who are you asking? I'm asking across the board.
I think in Denmark and Sweden and Norway, the short answer would be yes. There's a lot of support. Of course, it could always increase and it could be better. There's been in Denmark some issues that we had special schools a lot previously, and now we have a lot of inclusion, but especially some children are squeezed between the special schools and inclusion. They should be allowed to go to special schools, but they are forced to go into an ordinary school and are not thriving. So, but in general, at least Denmark, Sweden, and Norway have it. But I think Greenland will answer for.
Greenland will answer for Greenland. Thanks for the question. It was a very relevant question. In my hometown, Sisimiut, we do not live in the same city. We know each other, but I live up by the polar circle. In my hometown, there's only one psychologist to handle all these kids, and I can say that from January till July, there was 8 people who committed suicide in our city, and there was a lot of accidents. We are only about 5,000 people in our hometown, so statistically we are very in a very bad condition psychologically. Actually, our Greenlandic government asked the Danish government about a month ago for help, because also in the eastern part of Greenland, there have been a lot of child abuse and suicides. So we have some issues here. It's also difficult to diagnose young people. Because they cannot blive udredt.
There's nobody to give them a diagnosis.
Yes, there's no doctors or psychologists, and the doctors there they are only speaking Danish or other language, so you always have to have someone to translate things for you.
Thank you. Look, we're going to wrap up because we've got one more session to go yet. And I just want to touch on a couple of themes. One is, I think we've just seen a great model of international cooperation and collaboration. And I think I've been able to sense the collaboration between the panel members, and that augurs well. I think one of the terms that really struck me was this notion of universal courtesy. I think it's fantastic. I think we should explore that a lot more. It's a great turn of phrase. You've taken us on quite a journey in terms of the similarities and differences across the Nordic countries, and I think we really appreciate hearing that. So please put your hands together and thank you to our panel. And of course you all have to walk past me so I can ambush you with an umbrella as a token of our appreciation.